My name is Dr. Natalie Nugent. I'm a licensed clinical psychologist, and I am the Chief Operations Officer and Clinical Director for Huron Behavioral Health, which is a very rural community mental health in Huron County, Michigan. I'm here today to provide some information on how we feel AOT, the Assisted Outpatient Treatment program, has benefited our population that we serve. And I hope that this testimonial might have some information that makes folks more comfortable with utilizing it. From my perspective, assisted outpatient treatment under Michigan law is a really valuable tool that allows family members, friends, and healthcare providers the option to assist a loved one or client in receiving the services that may be critically necessary to sustain mental health functioning and to decrease the likelihood of things like inpatient hospitalization, incarceration, or severe decompensation. At Huron Behavioral Health, we have a clinical team spearheaded by a hospital and jail liaison who works collaboratively with our local court system and law enforcement to ensure that AOT is a viable treatment option. We have joint trainings, countywide work groups, individual relationship building, which is critical. And through those processes, Huron County has developed a robust AOT program to ensure that individuals with chronic, unremitting mental health concerns have access to providers who understand how to utilize AOT and can do so to prevent the revolving door of out-of-home placements, each of which we know increases the likelihood of further decompensation. We've actually been collecting data at Huron Behavioral Health for some time now related to individuals receiving services through AOT. So specifically, we have looked at the number of psychiatric inpatient placements a consumer has experienced both pre-AOT and post-AOT. So our data shows that in the 5 years preceding AOT initiation, our AOT enrolled consumers had about on average a 3.6 number of inpatient hospitalization stays. So on average, about 3.5 hospitalization stays. Following AOT initiation, the same population, our AOT enrolled folks, had only one AOT enrollee return to the hospital. So we went from on average about 3.5 hospitalizations per person to, in our entire group in the 5 years post AOT initiation, only one person returning to the hospital. So from our perspective, this is remarkable data. It's remarkable from a treatment perspective and from a cost effectiveness perspective. Through AOT initiation, consumers receive access to a full spectrum array of outpatient behavioral health services. It is less restrictive, less intrusive than hospitalization or incarceration. But they also receive ongoing monitoring to ensure that there's compliance with treatment, engagement with treatment, the opportunity to troubleshoot and problem solve if there are barriers preventing appropriate engagement. And so clinically, we've seen significant benefit to AOT utilization. We believe that it is absolutely a valuable tool to be used strategically in clinical care and sparingly, especially when alternative treatment engagement methods have failed. From our perspective, it's a valuable tool in our toolkit, and we feel very fortunate in Michigan to have this law on the books that allows us to work and utilize this particular tool when other methods have failed.